back to you for other comments before I call on Dr. Fleming again.
Okay, thank you, Dr. Gingrey, for yielding. In fact, this first bullet about the 100% deductibility will solve the problem with portability. Right now, 85% of America gets their health insurance through their employer. It's because employers can deduct the cost of their health insurance that they provide to their employees as a regular business expense, and the employee can get that money as a non-taxable benefit. But if we make it 100% deductible for everybody, then the employer can give that money in increased wages to the employee. It's still a deductible amount. It won't cost the employer any more money out of their bottom line, but they can give it to the employee. And then the employee can take those dollars, and instead of having to be saddled with whatever insurance policy that the employer provides for them, can go buy their insurance wherever they want with whatever kind of coverage that they want. In fact, Dr. Gingrey, you brought up something about the mandates that states have put on. My friend Neil Bortz, who has a radio program that's syndicated all over this country, keeps talking about that he and his wife, who are beyond the age of having any babies, have to buy maternity coverage. There are insurance policies that mandate that people have to pay for sex change operations or hair transplants or a whole lot of other things that everybody in that pool is going to have to pay for those, whether they want a sex transplant, a sex change operation or hair transplant or maternity benefits or anything else. And that just drives the cost up for everybody. And the cross-state line purchasing and the association pools will help stop that. We have managed care today because the employers want to have some finite amount of money for their own budgeting process so that they know what they're dealing with in their business, so they go and buy managed care policies for their employees so that they have some finite number, and it's not just a blank check, which makes sense from a business perspective, but it doesn't make sense for a lot of employees. They want to be able to choose their doctor. They want to be able to go to the hospital that they desire. They don't want to be dictated to about what kind of coverage that they can have. And the first point, where everybody has 100% deductibility of all expenses, will take care of the portability problems. It'll empower the patient and the doctor to be able to make the best decisions for their patients. So those things are just common sense solutions. And now you bet.